Okay, some issues you will face when you're there in your consulting with your patients. Do you inform their GP? I'm speaking, of course, from the UK base, where our patients in the UK and the Western world experience. Do you inform your GP, inform their GP with their consent? Do you do that routinely or not? It can be quite a dilemma. Some people don't want you to. You may worry that you ought to have some sort of dialogue. You may want to see their reports and so on. Very often people consult us as a last resort. They're just desperate for us to help. The concept of desperation, I kind of feel that the more desperate people are to get rid of a particular symptom, the more you might question as to whether they actually do. Because remember, people's disease state can be something where they feel quite safe. And sometimes I've had a situation where it was an ex-policeman actually, and he came to me desperate to get rid of these symptoms. Then we had a consultation and I took him through and demonstrated to him that his symptoms were better. But he clearly wasn't very happy about that, because he went away and I didn't see him for several months. And then I had a phone call. See, it's still there. So this is something, again, in practice, it's not always clear. You may be working with someone whose GP dislikes or distrusts homeopathy and doesn't understand it. The patient may refuse to visit their GP even if you ask them to. And so we have to recognise the limits of our ability, limits of homeopathy in complex cases, and do you need a chaperone? As a female, I'm sort of going to resist talking to a gentleman about their love life, for example. I might feel uneasy. But there could be a situation where you are put in a compromising position. So always think of that. Is there somebody else around? Certainly within the hospital systems, the issue of chaperoning was one that I'm sure you remember, was one that was taken very seriously. We have a variation in the people who come to see us. Some of them have used homeopathy all their life. Some use homeopathy for first aid and occasionally. If the person has phoned me up and I don't know them, I'm not going to give them too much to clutter their fear or whatever. So I will either give this to them and send this to them beforehand, or I will give this to them at the time. I take 2 hours to take a case. Some of you won't do that. I've been through the should I do that, should I not do that, but I've come back to this, taking that length of time, simply because people, well, often you need more than 2 hours. Medical history, childhood diseases. This is all probably familiar to you, or some of it is. Head injury accidents, I'm almost obsessed with that. Anyone with migraine, I'll always try and find a head injury somewhere. Sometimes they don't remember it, and again, weeks later they say, hey, by the way. Head injury and accidents, we often ignore that. There's 3 C's in accidents for anybody who hasn't noticed that. Dental history important. And some dentists will say the origin of all ill health comes from your mouth. Remember, you clench your jaws intentionally so that you can reflect your emotions and you work with your mouth. Hospital admissions, operations, vaccinations, allergies. X-ray scans, radio or chemotherapy, medicines, supplements. The normal things that you would expect to ask. The second page, social, smoking, alcohol, recreational drugs. Family, details about the family's health, parents, siblings, children. And even if adopted, patterns of health in close environment are important to note. And within psychology, we have what's called the nature and nurture debate. So is outcome related to nature? Are we born with it? Or do we learn it from the environment? This is a terribly important thing to consider. And obviously, if someone is adopted and it's not their blood relatives, we are still linking with the environment of which we're part. Now, the emotions here, I don't always do that first if someone is a little bit emotionally frantic. So I do behave in a flexible manner here. So, fear, anger, sadness, happiness. I'm interested, and what I say to them, I don't want you to think about your answers.
Because I actually believe that the homeopathic process, it has enhanced my consultation skills. It's enabled me to connect more effectively with my patients, which is, after all, the most important thing that we do when we are seeing a patient. Plus, it's really stimulating. There's a lot to know, and you never stop learning. You have qualified, you have your diplomas, you have your postgraduate certificates, but it's only the beginning. Sorry. Plus, I find that, I believe that, homeopathy reintroduces the art of medicine to the science of medicine. Yes, you've heard it before, but I'm sure it's true and I've seen it. So, personal satisfaction, yes. The reward, enjoyment of easing distress and suffering, and restoring health and well-being. So these are the three strategies which I find are effective, are treating on local features of the presenting symptom, the presenting illness, having made the diagnosis to elicit the symptoms. Plus, if you're lucky, some of the modalities. Is the joint stiffness worse with cold or worse with heat?
About 1 in 68 children worldwide has autism. 1 in 42 boys and 1 in 189 girls. So, boys are more trouble. 1 in 42, 1 in 189 are affected by autism, and 1 in every 250 children in India are autistic. So India has got a better, I don't know why God gifted. Is your child part of these rising statics? Go for homeopathy. We are not challenging. We had a wonderful lecture from dear Sarah and my dear Dr. Robinson. You know homeopathy works. What is autism? Actually, group of neurodevelopmental disorders called ASD. The symptoms of this spectrum are typically noticed between 12 to 18 months of age and almost always before the age of 3 years. So, in the childhood, when the baby is very young, you don't notice anything, 3 months, 6 months. After some certain age, nearly about the 1 year, you will see if something is wrong. If something is not natural, that brings the attention. It has demarcated into 3 types. Classic autism, most identified with when people think of autism. Here, the patient experiences significant impairment of language. Impairment of language. Want to say something, can't say. Something, language problem, first thing. Yes? Then, communication. You're telling something, do something, the child don't know what to do. Communication. And then, social skills. Do something, eat like this, sit like this, dress yourself, there is a problem. And child is usually intellectually sound. Intellectually sound, but can't do anything. They are not performing up to your knowledge. So, Asperger's syndrome is a mild version. A type and linguistic development and cognitive abilities are relatively intact. The third one, PDDS-NOS is called atypical autism and is diagnosed when child doesn't typically fit into the above 2 categories. 1 category, 2nd category, 3rd category. If the child is not in upper 2 category, then it is the 3rd category. So what happens in autism? 3 areas of functioning are disturbed. Mainly, social skills. They don't know how to do, what to do, how to play. Interpersonal and social skills are affected. Communication skills. You're telling something, they don't listen, and they don't know what to do. You're saying, go, open the door, close the door, bring the glass of water, come onto the dining table or something. And fixed obsession for an activity. Don't keep doing one thing. Keep doing one thing all the time. They are busy with something. Yeah, just like you can see, the little girl sitting and watching, they don't know what to do, objects. Then, aversion to change. They don't want to change their habit. If you're poking the finger on the nose, they say, no, don't do that, no, again, no. anything you tell them to do, they don't do it. They don't change. Genetic trait in the family is the one of the cause. Viral infections like rubella in pregnant mother, prenatal exposure to certain medications like vaporetin, I should not blame my dear friend sitting here, they will feel bad. Low birth weight and lack of oxygen during birth, very, very important. Low birth weight and lack of oxygen, very important factor here. So what are the risk factors for autism? Parental age. You see there is the age factor, late marriages. Children born to parents above 40 years have higher risk of being autistic. Gender of the child, boy 1 in 42 are more likely to develop autism than girls. There is a 1 in 189. And premature birth, therefore 26 of gestation, premature birth is also leading to the autism. What can autism lead to? Depression, you can see. Then ADHD, anxiety, their mood anxiety, restlessness. Behavioral problems, their behavior is different. And seizures, this is the very important. Don't say, oh, you're nothing, you're stupid, you're not behaving. Don't blame the child. It is not his fault, it's your fault. Maybe you married late. You should be marrying early. Maybe there was a problem with during hospital procedures or oxygen, lack of oxygen during delivery or something. Encourage normality, maintain an atmospheric of normalcy. If you see somebody is not natural, but you are natural, I see sometimes patients, they are behaving very erratically and they are very stupid. And just last evening, Bhavna was telling me, why are you so patient? I said, I have to be patient because I am a doctor, I am not a patient. Patient and patience, both sides of the problem. So here, you have to behave like this. In the morning, you say, oh, you're always lazy, you're not waking up, you're not doing something. Just say, come on, get up, my lovely baby, my lovely boy, something. Just encourage them. Rather than say, oh, you're nothing. Look at the next door, Alex is better than you. Yeah? Caddy is playing better than you. No, don't compare. Just encourage them. Be usual. Never be embarrassed about being with an autistic child. People see so much, they just behave like they are God's children. It's our duty. Make them better. Do not criticize them. If you can make them better, it's okay. If you can't, then say, I'm sorry. Never tell homeopathy, I do this, I do that. What will happen if nothing will happen?
What we have to do, we have to actually look at the patient holistically. And it's only when we followed his guidance that we will be able to see, to ascertain where the vital force is disturbed. So how can we practice being unprejudiced observers? He says that we have to take note only of the changes in the health of the body and the mind of our patient. We have to regard, we have to note, we have to observe. We have to note down those changes that we can see externally. As Sarah said, we have to use our senses. So what do we note down? The changes that have taken place in the patient from their healthy state into their disease state. So what are those changes that we think that we can see? You might see the way that they move. You might see if they cough, or if they sneeze, or if they've got any pus in their eyes, the discharges. And then that will lead you to ask about what makes them better, what makes them worse, the modalities. Then we ask about, or we have to note down, Helen says, the changes felt by the patient, the ones that they can tell us about, the ones that we can't actually see if they don't tell us. So things like insomnia,
Do they feel weak? What dreams have they got? Fears, temperature preferences, climate conditions. Do they like hot, dry conditions? Do they prefer it when it's cold and damp? What's their appetite like? What's their thirst like? And then thirdly, we have to listen. It's really important to see how quickly it settles in, whether it clings to its mother, whether it hides behind its mother, whether it proceeds to wreck the joint, which can happen, and see how they play with new toys. Are they interested? Do they just not want to know? These are all really important things that we have to take note of. Alternatively, if we visit them in their own home, they're in familiar surroundings, they're going to be naturally more confident than if they came into our consulting room. We're also likely to see them react with their siblings in a much different way. Again, they're going to be more confident, familiar territory. If a fight's going to erupt, you're going to know all about it. And also the toys are familiar, and they're going to have favourite toys. So you will see whether they're sharing, whether they're happy to give, whether they are going to create a storm if somebody tries to take it away from them. So these things are really important that we have to note down when we're taking a paediatric consultation. They're shy. They're not confident. They feel that you're getting too close into their personal space. Again, these are all things that we need to take notice of. One is the law of opposites, which conventional medicine uses today: antidepressants, antispasmodics, antibiotics, and the law of similars, homeopathy. Dr. Hahnemann demonstrated this law, the law of similars, as being universal, and so homeopathy came into being. So even at its very beginning, we can see that homeopathy was based on observation and fundamental law. Likewise, all the other laws and principles of homeopathy can be found to be in agreement with the fundamental laws. Think of the law of cure, to get well from above to below.
Please.
Mr. Farrakhan. Okay, I'm here.
Pick up. Yeah. Yes.
Okay, one more look beside,
look
please.
here.
Thank you.
Yeah.
Tell me. Okay.
Mr. Haynes. Dr. Patil.
Okay. Yes, sir. That's it. Thank you.
Thank you, sir.
Look beside. Okay. Second. One more. Put it. Yeah. I'm here. Okay. Look beside, please.
Yeah.
She's not looking
Thank
here.
you. Look at the camera.
One more. Put his on all. Okay, I'm here, sir. Okay, one more, sir. Sorry. Yes, sir. Okay, Dr. Wen, look. Okay, one more. Thank you.
Please.
Okay.
It's very hard.
Right. यार एक क्या भाई साहब आप इधर आ रही है इसके नहीं yes sir okay one more चलो
Now, very study of London. Parul. Yes. Parul will get from.
well
Oh, Parma Priya. Parma Priya.
okay Parma thank you
Delicious. Sheila Cooper.
one more
Too much of sweating.
okay
Please.
okay
One more. This is being awarded the gold medal awarded to Harshal Rao. Achievement. You can take this out. Yes. Together, all together, you are honoring. Always helping me. Okay. Can I ask? Go this side.
This side, please. This side, sir. Okay. Okay. Okay, Bhavna.
I invite of the seminar. Please. Please. All together. Please. Angelica, madam, please come together. All of you. All of you together.
Okay.
And this is not official, but you have. Yeah. I will ask Sarah, madam, you give this award. Yeah, because of him I'm here today. He drew me all the way. Thank you very much. Thank you. Please go for the team.